that's my co-authors and me, we will present a poster on the seizure-free days, the number of seizure-free days with adjunctive cenobamate. And this is a post-hoc analysis of one of the pivotal trials, or better say, of the open-label extension of one of those trials. The trial is the C017 trial, one of the two big trials who showed the efficacy of cenobamate in focal drug-refractory epilepsy as compared to placebo. And of course, the regular outcome criteria like the median reduction in seizure frequency and the proportion of 50% responders have been shown during this double-blind trial. But we looked at the number of seizure-free days in the open-label extension phase. So why is it important to look at seizure-free days? According to our clinical experience, it is quite important for patients to have a day which is completely without any seizures. If someone has a day with one seizure or a day with 2 or 3 seizures, that does not make necessarily such a difference. But a day completely without any seizure is very important for many patients. We had a look at those patients who completed the double-blind study and they were eligible to enter the open-label extension. And then there was a conversion period because some of the patients came from placebo and all of them went into open-label extension then. And we compared the seizure-free days during the open-label extension with the period before the patients they were put on cenobamate. And what we saw is the following. It was a long-term open-label extension, so patients were observed up to 5 years, and the number of seizure-free days remained quite constant, which is very good. Constant and consistent and continuing effect over time. Of course, the better the response to the drug was, the higher the number of seizure-free days. But there were also fair number of seizure-free days in those who were not let's say 90% responders, but also for the 75 and 50% responders. So, of course, it's very important to have a look at concomitant medication, and we grouped concomitant medications the patients were on according to their mechanism of action, and there was no relevant difference with regard to the number of seizure-free days, depending on the MOA, the mechanism of action of the concomitant ASMs. When we talk about patients in trials, there are patients who, had just failed 2 or 3 prior anti-seizure medications, and there were patients in the trial who had failed on 7 or even more ASMs before. The fewer drugs had been failed in the patients, the better was the outcome in terms of seizure-free days. But anyway, even those with a higher number of failed drug trials before had very good numbers of seizure-free days during this trial. So in conclusion, there was a sustained improvement in the percentage of seizure-free days during the trial and during the open-label extension. Yes, this is another confirmation that cenobamate can reduce the day-to-day seizure burden in patients with inadequately controlled focal epilepsies. And we observed improvements in the number of seizure-free days in patients with concomitant ASMs of varying modes of actions.